Good morning and hello. Welcome to this morning's program being sponsored by the National Association of Corporate Directors of New England. I'm Ellen Zane and I'm on the board of NACD of New England. Well, excuse me. I want to thank you for joining us for our virtual program today entitled The Transformation of Healthcare and Its Impact on Board Governance. Before we get started, we have a couple of housekeeping items that we need to review. First, a reminder to remain muted throughout the program and to use the chat function to pose questions. No need to wait until the Q&A portion of the event to submit your questions. We will monitor the chat box during the panel discussion and intersperse questions as they come up. Next, we know that many of you want to receive credits for today's program. To receive credit, we need to know your first and last name. Please make sure that your name is completely visible on your Zoom window. If you are on this call via the phone, send an email to Larissa Rivetto so that you can receive credit. Finally, the panelists and moderators' statements and opinions are their own and not the companies with which they work. So I would be remiss if I didn't thank all of our chapter sponsors. There are many, and the continued loyalty of these organizations underscores the important role of NACD. It is their support that allows us to fulfill our mission of delivering world-class, director-centric, local programming and peer-to-peer sharing of insights that's so vital to advancing excellence in the boardroom. Today, we are highlighting two very special sponsors, Grant Thornton and Aaron Fox, who have continued to support our mission of excellent corporate governance, and we thank you for your support. Now, it's my pleasure to introduce today's moderator, Michael Peregrine. Michael is a partner at McDermott, Will & Emery, and Michael, take it away. I know we'll all enjoy it.
Thank you, Ellen, and I'm delighted to be here today and pleased to introduce the terrific panel of speakers that we have for you. First is Jeremy Dolinsky, the Chief Operating Officer of Devoted Health. We also have with us Kevin Tabb, who is the Chief Executive Officer and ex officio board member at Beth Israel Lahey and chair of the board of the Massachusetts Hospital Association. And also Phyllis Yale, who has been a member of 10 different healthcare boards and chaired 2. At the moment, she sits on the boards of BMS, DaVita, Blue Cross Blue Shield of Massachusetts, Aledade, and a startup biotech company. She's also an advisory partner for Bain & Company. Thank you all for your time this morning. We're going to have a panel discussion through a series of questions over the next hour or so, and I'd like to kick it off with it's a kind of a catchphrase we use from time to time, transformations. But I'd like, maybe beginning with Jeremy, each one of you to comment on what you see as the emerging trends at a high level within the industry from each of your perspectives, again, with the focus on transformations that are occurring. And as you comment, I'm particularly interested on behalf of our guests that you highlight any current disruptors. So Jeremy, why don't you kick it off on the transformation issue? What are you seeing right now?
Sure. Thanks. Good morning. So where I sit, I work for a Medicare Advantage plan and I'm on the board of the company, and I'm also on the board of R1 RCM, which manages the revenue cycle for large health systems. And so that's the focus that I have in healthcare. By far, the biggest transformation that I see and that impacts what I do all day is government policy. And I know that the buzzwords around AI sort of dominate most headlines right now, and I know that the scrutiny on M&A activity dominates a lot of headlines, but the amount of policy change that we're seeing on an annual basis coming out of CMS right now is actually pretty stunning. And so I'd say that some of the most exciting reading every year is the proposed rule and then the final rule. and then the preliminary rate notice and the final rate notice coming from CMS. And I think why I cite policy as the biggest driver here of transformation is that we're just seeing unbelievable year-to-year shifts. So, we've been talking about value-based care as an industry for, I don't know, it seems like decades. And through essentially the stroke of policy pen, we've seen the legs completely knocked beneath all of the value-based care, primary care groups out there in the last year. And that came in the form of a pretty dramatic change to our risk adjustment model. We're overhauling the Medicare Part D program in 2025. We call that the Inflation Reduction Act. And I think that most people have no idea what the changes are, but we're essentially moving the Part D benefit to the age of managed care. So it used to be that the government would pick up the bill for 80% of the risk that, and that the Part D program was just a cash flow smoothing thing for plan sponsors. In beginning next year, 80% of the risk now falls to private payers. Manufacturers have significantly more skin in the game. And the American consumer is going to see for the first time their out-of-pocket expenses capped at a much lower amount. But what the American consumer is not expecting is managed care on the Part D benefit. Because what we haven't seen yet is the impact of Medicare price negotiation. That's not coming for a few more years, and the early returns aren't good in terms of how those negotiations are going. And so I think that we're going to see step therapy like we've never seen it before on pharmaceutical treatments for Medicare beneficiaries. And so I think that all of that transformation presents opportunities, right? So creates a lot of headwinds, but also creates a lot of opportunities for companies who understand these changes and can capitalize on the disruptions that occur in the market because of them. And maybe I'll pause there and let some other participants jump in.
Jeremy, before we turn to Kevin, I love the focus on policy, and one of the questions that I'd like Kevin and Phyllis and you to think about as we talk about this transformation issue is where do we draw the line in terms of what management should be sharing with the board and what the board should know on its own, and the whole education piece, and maybe Kevin, if you'll give that some thought as well. But Jeremy, do you have any initial thoughts on how you've been in various different roles within the hierarchy? What would be your expectation on what the board should be advised on in terms of these fascinating policy shifts?
So I think in the sector of healthcare, the boards need to spend a lot of time on the regulatory risks of the business and educating themselves about what the raw material is. The material is dense, and you got to just read it. And I think that on all of the management teams of companies where our participants might be board members, we really need to have a strong government affairs person who can parse these changes, understand and translate the impacts to the business, and ideally build some advocacy around it. But there's nothing better than actually reading the text, I guess I would say.
Kevin, what's your perspective as both a senior executive on the large health system board and from the MHA's perspective? How do you view transformation right now?
Yeah, so I agree with a lot of what Jeremy said, although I'm going to take a little bit of a different slant to this and maybe a contrarian view and suggest, notwithstanding everything else, there hasn't yet been massive transformation in healthcare. There are massive pressures. There's unprecedented pressure on the healthcare system, but we haven't yet seen this completely play out. And so there's a difference between the unprecedented pressures that we're seeing, and I'm going to talk a little bit about that, and the transformation I think that we expect to occur, but hasn't yet occurred. So what am I talking about when I talk about unprecedented pressures? First of all, many of us have been doing this for a long time. I've heard that word unprecedented every year for the last 30 years. Can't be that every year is unprecedented. It's really unprecedented now. Coming out of the pandemic, we're seeing pressures in a variety of different ways that really are nothing like what we've ever seen before. So that is everything from, as Jeremy mentioned, sort of a changing government policy, but that's just a small piece of it, in fact, to changing expectations of patients, to changing expectations of our own employees, our workforce, and then ultimately sort of underlying all of this, massive financial pressures on providers in a way that really never existed before. So healthcare providers in this country, or certainly in New England, always existed, played on the edge, I'd say. Not the nonprofit providers skirted along slightly above break-even margins, made it work, and didn't transform because they could make it work. But it was never a massively profitable business. That entire dynamic changed during the pandemic. And then interestingly, as we came out of the pandemic, not only did it not get better, it got worse. It got worse because of a change in the workforce. It got worse because of a change in the way that people are insured. And ultimately, what it means is we now expect to see a wave of things change. Everything from the wave of mergers and acquisitions on the provider space that we have seen for some time and has now accelerated, to a wave of providers, hospitals, solo practitioners and others simply going out of business, shutting their doors, including in New England, wholesale exiting of the market of some providers, for profits, for instance. And all of that together, coupled with, we're seeing more patients beating down our doors, has really created both a crisis, but as Jeremy said, I think also an opportunity, because it's only at times like this where we're really going to get change. And so then when we talk about things like AI, and AI, I think, is just an example of the kinds of things that we're going to need to incorporate to really change. We're really going to start to be forced to get innovative, which I think is a good thing, because those organizations that don't push themselves to use technologies in innovative ways, to get innovative with their own workforce, to engage with the patient population in a way that's different, they're simply not going to make it. And so when I think about sort of change and innovation, I think about what's coming and why it's coming rather than what has already happened. As it relates to sort of the role of the board and the management, you asked what's the responsibility of management to inform the board? It's always the responsibility of the management to inform the board. It's the responsibility of the board to inform itself and to ask the right questions. It's not the responsibility of the board to be management itself. It's impossible for a board, and certainly in the increasingly complex healthcare environment, certainly in an environment where organizations are getting bigger and more complex as we go through this wave of mergers and acquisitions, no single board member alone, nor I think a board in its entirety, can expect in essence to step in and manage an organization. It's the role of the board to make sure that they have the right management team, to make sure that they're asking the right questions, to make sure that they're getting informed by the management team that exists, and to provide overall oversight and governance. And I think that just like I talked about a changing landscape for providers and therefore for management, I think it's a changing landscape for boards and individual board members as they think about balancing it. So moving away, as organizations get more complex, moving away from spending an inordinate amount of time on small intricacies related to operations and moving towards the larger strategic questions. Are we moving in the right direction?
Kevin, that's a perfect setup to turn to Phyllis with her extraordinary background on multiple boards across the healthcare spectrum. Phyllis, do you agree with Kevin on these points?
Yeah, I'm going to pick up where Kevin ended, which is the management board relationship. I do think that the level of change, the amount of pressure, the change required is so great that board members need to spend a lot more time understanding the dynamic. And I think largely that is management informing the board. Because we need to keep up. We need to be responsive. When management comes and says we need to spend $1 billion on X, we need to be able to know, well, that's not even enough. We need to spend $2 billion, or ask the right questions. So there needs to be a lot more information. One of the things I have recommended to boards, I think is really effective, is in anticipation of a big strategy retreat, which most of us do annually, to do some optional but encouraged information sessions, deep dives on different topics, just to get informed. And different members of management give talks, give little lessons, if you will, on different topics. I've done this at a number of my boards, at DaVita, at BMS, at Blue Cross, and it's very helpful. But I'm going to go to your first question, Michael, now, which is, where do I see the transformations? And again, I have the benefit of having a pretty wide aperture, so I could talk about any number of them, but they all do start with some exogenous change. It could be a government policy change. It could be a market structure change. It could be technology like AI, but in BMS's world, it's the science of CAR-Ts and all the new kinds of science coming to the fore. And so let me just give you 3 little vignettes and link it back to the board. So DaVita is transforming from a fee-for-service dialysis provider, charging each dialysis treatment at a time, to a value-based care provider. We are taking care of populations of people with end-stage renal disease who are in dialysis, and saving money and improving healthcare by keeping them healthy and out of the hospital. And it's exciting, but it's a tough transformation. The management has said it will take a certain number of years, and we have told Wall Street it's going to cost $500 million before we finally break even in 2026. Now we're about 400 million in to this $500 million operating cost investment. It was important for the board to understand why, to understand we couldn't do business as usual, to understand why that was a reasonable pace, to support the management's view that it was the right pace, because you could make choices about how much you lose and how quickly and how far you lean into signing contracts with health plans and so on and so forth. But that is one example. Another example, BMS. Jeremy talked about the IRA and the negotiations going on. BMS has the first of those drugs, Eliquis. And we'll be able to talk about the price in September. That is when we are permitted. And so we'll see how that plays out. But IRA has, again, a policy change has forced us to BMS to transform speed. When you finally have a real end to a branded price level in the marketplace, you've got to be much faster at developing a drug, much faster. And so we have been on the slow end of the industry, and we want to be the fastest. I believe the faster you are, the more competitive you are, the drugs that you could possibly license from biotechs are worth more to you than somebody else, because you're going to get more years out of it. And so the math demands that you get much faster. To do that transformation, actually, that's a place where AI is quite relevant. And we're using AI in the discovery process and the development process. And I could go on, but there is a transformation happening in just about every company I'm involved with. And the pressures come from policy and from other factors, and it demands a higher level of performance from the board.
Phyllis, I appreciate your raising with BMS Eliquis. I had my Eliquis this morning, so if I doze off in the middle of this conversation, we'll blame you. You mentioned something, though, I'd like to, before we move on to our next focus, to just touch base with each of you briefly. From a general perspective, we read every day with respect to the what AI will bring into the future of healthcare. It's an enormous topic. It's been almost overblown in many instances, or over covered, and we've also been living the last month or so within the entire industry with the unique challenges associated with the cyber issues. I think ranging from one, the unbelievable damage done at Lurie Children's Hospital in Chicago, and then the Change Healthcare situation. Phyllis, can you kind of offer your views on how do boards deal with these types of developments and these risks? I know they're enormous topics, but when you see these things being thrust into the daily headlines, what's the board's role in examining them, bringing them up to management, asking questions?
Cyber is tricky because even if you have an expert on the board, there's not enough expertise in one human being. So I think with cyber, boards have two levers. One is to really push on the amount that we're spending on cyber and make sure we're spending enough. There was an interesting Wall Street Journal article yesterday. I don't know how many of you saw it. It says that our industry, the healthcare industry, spends, it wasn't a good measure, 8% of IT spending. It should be of total revenue. But anyway, 8% of IT spending on cyber, and financial services, which I think in many ways is our best comparator, is double that of IT spending. So in any event, I think we can push on the budget, and I think we can hire outside experts to evaluate our cyber defenses. And then we can judge whether our CIO and our CISO is competent, but really, how do we do that? So this is a partnership with management, and the board has only a couple of levers here. I think more interesting is AI, but let me pause and maybe the others want to comment on the cyber.
Yes, Kevin, interested in your perspective. You've had a seat at the front lines in terms of the provider impacts of the cyber events. What's your view?
Yeah, first of all, I think Phyllis is spot on. I'd say I agree with everything that was just said. You know, it's a little bit of a cliche, but it is absolutely true. When it comes to cybersecurity, it is not a question of if we will be attacked in healthcare, and probably beyond healthcare, but it's just a question of when we'll be attacked. And so, you know, I think we need to start with that premise, which is, and in fact, my organization, as an example, is attacked every single day. The vast majority of those attacks are not successful, but we are attacked every single day. So, you know, we've seen just in the last 2 months of a number of really impactful attacks, right? So we're talking about everything from in the payer space in New England, Point32 really crippled for many months by a ransomware attack. My own organization had a small hospital taken down from an IT perspective by another ransomware attack. And then the Change Healthcare debacle, which from my perspective is actually most interesting, not because of the cyber attack, but because it was an example of an unexpected consequence of consolidation in the market. The fact that more than 50% of the providers are dependent on a service now across the entire country from a single provider meant that there was a single point of failure. And that's what made this particularly dangerous. So as Phyllis said, you know, there's a limited amount that the board itself can do around cybersecurity. There are only a small number of levers, in essence. The first is to make sure that it has the right management team in place, and that it's hearing from the management team about the steps in place to push the management team to make sure that they are spending and doing enough. I think also, just like with finances, requiring external audits. We do that around finances. We have to do that around IT too. Phyllis mentioned that there's not enough expertise in board members themselves to do this. I don't think any single organization on the management team or anything else has enough expertise on its own. And so just, again, the parallel, I think, is financial audits. We need those same things, including external audits around IT and IT risks for cybersecurity issues. We get those after the fact. We get those when we've been attacked, and then everybody says, oh, we need to go out now and get, but we need to do those things prior, if not prior to being attacked, certainly prior to being taken down, in essence. And that's one of the lessons that we are learning now.
Can I follow up on one point which you made, which I think is really critical, and that goes to Change Healthcare and the industry dependence. Is that a conversation that management should be having with the board and saying, you know, here is how our institution is dependent. Here are the relationships if one goes down. Is that a broader conversation from a risk perspective that the board needs to be made aware of?
Absolutely. And to be clear, I think that management teams themselves are only starting to grapple with that issue. And so extrapolating out and saying, oh my goodness, we, the country, were just taken down in the healthcare space by reliance on Change Healthcare. I was given a call when Change Healthcare went down. And you know what my first question was? Who's Change Healthcare? Like
I'm glad you said that.
Yeah. So I had never heard of Change Healthcare. And yet half of my system is reliant on Change Healthcare to be the transactional agent, the way that we submit claims. My next question was, how many other change-like healthcares do we have within our own organization? And I don't think that we even know the answer to that. So we're now in the midst of conducting our own quasi-audit of what other sorts of risks, and they're not just in the IT space, are we now seeing because we're reliant on a single large vendor? And we're just going through that ourselves. And then, yes, that's a really good discussion to have with the board.
And
Jeremy,
if I could just piggyback on Kevin, which is, I had 3 board meetings in the last 2 weeks, and change was on the agenda for each of them. I mean, Blue Cross, we got an email the next morning about the implications and so on. Aledade, we're in the business of partnering with physicians in our small to mid-sized primary care practices all over the country. Some of them were starving. I mean, they couldn't operate. So we were in a position to forward the money. We had amazingly set up a line of credit to do these kinds of things a year ago. And so we could forward them some money and basically really help them out. And then DeVito, the conversation was about liquidity, and depending on how long Change was out, what our liquidity needs were, and did we have enough liquidity, and we stopped our share buybacks and so on and so forth. And we had the same conversation Kevin did, which is who knew how dependent we were as a system on Change. We got our secondary clearinghouses, because that's in essence what we're talking about is a clearinghouse, and ask the same question, which is what else is a pinch point that we're not aware? Exactly.
Jeremy, from your CEO perspective, how do you see the issue?
Yeah, so before I was a COO, I've been a chief technology officer at Athena Health, at Wayfair, and I run technology at Devoted. I think I think piggybacking on a couple thoughts here. One is that I think one role that the board can really play here is enabling the courage and the safety to miss the numbers when it comes to the spending here, right? So it's a very, very unnatural thing for any management team intra-year or even, for 1 year to the next, to say there's a function within our company that has a significantly incorrect level of investment in it. Because what that does is it ripples through the future, and you got to figure out how to pay for it. And people tend to avoid those conversations because they're sort of unpleasant, right? Whenever you say there's some bad news thing that we really have to just spend more money on, I've seen situations where there's been hostility towards that. And I think that one very important tone setting thing that boards can do is welcome that news when it's critical to the performance and the safety and the reputation of the organization. And I do think that every board director should go back and ask critical questions in the wake of change. And point 32, and it's not just one incident, but in healthcare, the healthcare data is more valuable on the dark web than financial services data right now. That was not true 10 years ago, and and healthcare data is valued at a multiple these days. And I think that data that Phyllis shared is really compelling about this differential spend between the industries. I think that one thing I also would say is that just like on any board, particularly one that is either venture backed or private equity owned or is public, you need to have a cadre of true financial experts on the board. So, you typically see a former CFO, a current CFO, or a CEO who was a CFO who can really help guide the audit committee and earnings seasons and things like that. I do think that cyber is now important enough that you do need somebody on the audit committee who knows or whether it's under the auspices of audit or whether it's under the auspices of a compliance and risk committee, depends on the company. I think you do need to have at least someone on the board who can ask the questions that need to be asked of the CISO and make sure that the program is robust enough. The last thing I would just say about the change outage is that, if there was a set of technologies that were going to be incredibly vulnerable, were those set. The clearinghouse technology that Change and Optum owns is the amalgamation of many, many different acquisitions from McKesson and Mdion, and before that WebMD. And I think that the business case to rebuild software applications has not really been grounded yet in enabling technology teams to move faster and making them safer. The number of security patches that have come up over the life cycle of the technologies that Change Healthcare was built upon has probably been in the hundreds of thousands. And I guarantee they weren't current, versus when you build in cloud native technologies, you get all that for free. And so I do think that some of our end of life software applications, and when I say end of life, I mean, some of these systems were built in the late 90s that are in current use. Systems that are 20 plus years old have glaring vulnerabilities from a security perspective. And I also guarantee that they're making our teams far less productive than they can be. And we're spending more on technology than we need to. And so that's another difficult conversation that boards, I think, have to create a safe space for, about what you do with those things. Because that's a relatively new thing to deal with, end of life software applications, right? Wasn't a conversation that we've had a lot of conversation about since Y2K, right? It's been a long time.
Well, keep that technology.
Sorry, I just want to jump in and say, I think that that's true, and healthcare providers are themselves very much akin to Change Healthcare. We at Beth Israel Health have hundreds and hundreds of different software applications that are either not integrated at all or are very partially integrated, are at various stages in their life cycle. And we don't even have the ability, we can't ourselves rewrite those stacks. We can't ourselves, and we are dependent on hundreds of different applications at very different stages, presenting the exact risk that you're describing for an individual company like Change or Optum, except multiplied many times over if you're a provider dependent on literally hundreds of different applications.
Well, I wanted to go back to Jeremy for 1 second, and take advantage of his technology expertise. Obviously, the subject of AI is way beyond the time limits of this presentation. But given the conversation we're having about board member responsibilities, Jeremy, what's your perspective on the impact of AI on the board's role, especially with respect to the board's view of risk and the advantages and disadvantages? And then we'll pick up on the other panelists' view.
Sure. So I think, first of all, I think that every board member needs to actually understand what the business opportunity is, because I think that as it's covered in the media, you would think that, using ChatGPT is the equivalent in some way of like a sentient being, and it's not. So AI as a business opportunity, I view as simply the next big unit cost unlocker that came after robotic process automation, and that itself came after just the idea of offshoring altogether. So you make people a lot more efficient through the proper application of these technologies, but there's an incredible amount of danger, right? So I think that people who are thinking of AI as replacing human beings, an attempt to replace human beings, are going to make major mistakes. They're going to make customers very angry. And they also, I think, have created opening a door to potential in healthcare for significant harm of patients and significant legal risk. And so there was a White House sort of convening activity where 28 healthcare organizations signed on to some principles around the use of AI. And it's, the FAVES framework. It's fair, appropriate, valid, effective, safe. I think that we as boards need to help our organizations both understand what the business opportunity is, but also understand what our rules of the road are. Right. And we should, as board members, should be very frightened if the teams don't demonstrate an understanding of what the technology is capable of today, but also how it, if they're talking about replacing people, if they're talking about replacing clinical judgment, there's something wrong and you should be very, very nervous. And I think that we've already seen organizations get into trouble, and there are some payer organizations that were essentially penalizing clinicians for making decisions that were in contradiction to what a machine learning model would have predicted. We should be embracing the differences. Like humans make these models better. And we should be very, very worried about creating incentive structures where people get evaluated against how much they agree with what the technology says. Because these hallucinations in the models are very, very, very real. AI is a liar. It is. It makes stuff up sometimes. And it's so devious that most of the time it's fantastic. And then the times when it's wrong, it's horrific. And so it's dangerous as this new technology gets unleashed if organizations don't have the governance around the appropriate usage of it. And I think that's what boards can help bring, right? Like, what are our rules of the road? How are we ensuring that our data is actually staying private? Because that depends on the implementation of the AI technology stack that you're using. How are we keeping are we locking down our environment? Because you can just go, I was in a meeting recently where an AI note-taking application joined a Google Meet. And if people on the call hadn't noticed it, significant amount of private information could have been out there. So there's a lot to rethink in the technology infrastructure as well, because there's all these productivity tools that are being rolled out to business users that they oftentimes can just activate in the browser through an extension. And if you're not locking that stuff down, you've got a lot of leakage opportunity. So I'll pause there. I could go on forever on
No,
this,
no,
but
I think that's a fascinating conversation. And Kevin,
Yeah.
how are you introducing these issues with your board?
Yeah. So first of all, when I think about AI, like I think about a transformation in healthcare, I think we're talking about the promise of change as opposed to the change that has already occurred. And I think there's no question that AI has a really powerful potential to transform healthcare, in some ways for the better and in some ways for the worse. But if we talk a little bit about the better, I think it's important to remember it's a tool. It's not a replacement of people. It's a tool. And what it can replace in the best of circumstances are fallible people. When we look at the mistakes that AI makes, remember how many mistakes people make also, and think about where can it be applied that is actually effective and better than what we have now. Let me just give a couple of examples. So we're using it already. We're using it in clinical decision support. We're using it in medical imaging and radiology. We're using it in patient monitoring. And we're actually using it in some areas around operational efficiency. So an example, we've got something that we developed ourselves, an AI powered radiology protocol, which is in essence a predictor to say, based on free text that the clinician inputs, which tests should be ordered. And when we went and studied it ourselves, when we use this, it's ordering the right tests in more than 85% of the time. And then we went and asked ourselves, well, in what percent of the time were we ordering the right tests when we weren't using an AI tool? And it was much lower than 85%. So you may say, well, wait, 85%, wait a minute, what about the 15% that is wrong? And I think the right question to ask is, in what percentage were you wrong when you weren't using an AI tool? So that's an example. Another example is, AI-enabled wearables, devices to help us monitor patient vital signs and other things. And there are mistakes there too. But we see far more mistakes around monitoring when we don't enable tools like this. So, there are some definite advantages today to using AI as a tool to enable existing providers. And then there are huge risks also. Data accuracy, right? And so, Jeremy said, AI makes stuff up, and we see that all the time. Bias, you got to be cognizant of bias, and data collection itself is subject to bias. I think as it relates to bias, I go back to the previous point I made, which is we have plenty of inherent bias without AI tools also. And so how do we ensure, as we put in place the tools, that we don't magnify the kinds of biased decisions that we make already? We've got ethical and legal considerations. We've got privacy and security questions. There are, for us, workforce implications, right? So it's got the potential to really disrupt the existing workflows and require our own workforce to get new skills that some of them are equipped to acquire and some of them are not equipped, right? So when we think about all that, it's just like with cybersecurity. The board itself, no single board member is equipped to answer all of the questions, but the board has to be proactive and involved in asking the right questions about what the potential risks are, in making sure that there are pretty robust governance frameworks, oversight mechanisms, and risk mitigation strategies. Again, no different than with finances or with cybersecurity or with quality. I think it's very analogous to everything else that a board needs to oversee. So, I think we internally with our management teams have AI governance structures and ethics boards now, but they're going to have to be external risk assessment also as we incorporate these tools.
Phyllis, from a board member's perspective, is all this overwhelming?
We can't let it overwhelm us.
That's important because you say it again. That's so true.
The thing I would add to the excellent remarks that have already been made is I think there's a difference between clinical work and administrative work. And with the clinical work, you have to have all of the governance frameworks that Kevin described. You need to be cautious. You need to test everything you do for equity and correctness and so on. So applying it in a clinical setting has significant risks, significant upside, but significant risks. We're using AI in a number of my boards, if you will, old-fashioned AI, not generative AI. So, you know, in DaVita, we're taking all the data from all of those dialyzers and examining it and using it to analyze and predict and so on. It's the old-fashioned way. Administrative uses, I think you can really encourage the organization to experiment. So BMS has, is it least licensed in, you know, an individual instance of OpenAI's GPT and has put every document from human resources up there. And they're watching what the employees are doing, and people are asking questions. So if I took 4 days last year and I want to take 3 days next year on my vacation, can I do it? And they get a decent answer, and it scans all of the relevant documents. Anyway, you know, you can imagine it's both saving time, saving money, and it's just interesting to see what people are doing. And you have to be a lot less worried about that kind of thing. And I think we want to lean in to that. And so the challenge for a board, and I'll end on this point, is having two things true at the same time: worrying about the risks, but leaning into the opportunities, and not always having a scaredy cat risk framework for everything. Sometimes you gotta really encourage some innovation and risk taking in the appropriate way.
Well, hold that risk-taking point, and I'd like to start with you and asking a question that Kevin kind of spoke to earlier, and it really relates to the big picture issue of strategy. If the board's time is being taken up so much by some of these AI, cyber, and other issues, how much time must there need to be in a transforming healthcare industry on the strategy, the long-term strategy of the organization? Do we need? Are you seeing, Phyllis, on your boards, enough time being spent on strategy discussions? Are they different discussions? Who's leading them? What's your perspective? Again, strategy in a transformational industry.
Well, I think everybody who sits on a board on this call would say they'd rather spend more time on strategy and less time on the fiduciary stuff. So that's always been true, and it remains true today.
And is it a risk? If I jump in, is that a risk? Is that a concern? Do we gravitate
we need
to
to take the time. I have on one of my boards lengthened the time of our board meetings. We lengthened them once, we're lengthening them again. So I do think it's a good practice to do an annual deep dive into strategy and really check it. But once a year is no longer enough. I think with some of these fast changing, what you can do once a year is to say, here are the 5 major initiatives that will take us from here to there over multiple years. And over the course of the year, we need to look at each of those 5 initiatives, because you've got to be flexible and fluid and more agile than the old way of strategy of saying, okay, let's do the Gantt chart. First, we're going to do this, then we're going to do that, then we're going to do that. So I think you've got to be agile. I think you've got to check in during the year, but it needs to be in a framework that's settled every so often, every year, every few years. And I think that is how strategy should change in this rapidly changing world.
Kevin, what's your perspective, and how do you have a special approach to strategy on your boards?
Yeah, I smiled when Phyllis said every board member would love to spend all of their time on strategy, more, and that's the quote unquote sexy stuff. I think that's true, and I hear that all the time. Of course, everybody's definition of strategy is different. So when people use this word strategy as a catch-all for whatever people want to spend their time on sometimes, I think great organizations and great boards find a way to balance things. So this isn't specific to a board. I think it's specific to organizations, particularly in times of change. When I think about my own organization, we need to both be very, very focused on basic blocking and tackling, on the issues of the day as they come up and dealing with them, particularly in a time when we operate on a razor's edge, balanced with also building to a future which is really going to look different. The phrase that I always use with my own team is we have to be able to walk and chew gum at the same time. So they're not mutually exclusive. They're not mutually exclusive for an organization, and they're not mutually exclusive in what a board discusses. Time needs to be given to both of those things. Are we, and too frequently you see in organizations and boards really only focus on one or the other. So in a time of crisis, are we delivering on our quarterly results? Are we doing the basic things that we need to do to deliver on our missions in the short term? And we really need to be focused on those things. But if that's all you focus on and you neglect what the future will look like and building towards that future, that's a mistake. And then you see other organizations that really don't want to spend the time talking about that day to day. That's wonderful to talk about the future, but if you don't get there, then it doesn't make any difference how much you talk about the future. And so boards are no different than the rest of the organization. We need to balance the time spent on both of those things.
Jeremy, do you see it the same way?
Yeah, I do. I think that a lot of agreement. The one thing that my background's always been in sort of high growth, technology oriented businesses, and where there's a lot of strategy that comes from the founding team about what we're going after and why. And strategy sometimes I've seen strategy be used in board meetings sometimes as a little bit of ritual theater to keep everybody entertained, and that's the kind of strategy conversation I don't really enjoy very much, right? Where it's but what I would say is that the most important moments that I've seen and over the course of my career has been when the market turned out to be smaller than people thought it was for the thing we were doing. And all of a sudden, you have this crisis of, oh boy, what else are we going to do? And I think that, so what it's created in my mind as an operator is this just natural attraction to businesses that have really large addressable markets, but also to be really, really paranoid about, is there some hidden growth asymptote somewhere where like the market's actually smaller than you think it is? And I think that's a framework I use myself to think about strategy, because quite frankly, when things are going well in companies and you're growing quickly and the financial performance is great, the strategy conversations are quite honestly like a little less important, unless they're about this paranoia about when will the good times no longer be good because of something that we're not anticipating about what the market dynamics really are. And so I think, I thought the point about, well, what is strategy? Because it means lots of things to different people. To me, it really is that. It's like really understanding how much runway exists for a given business before you got to do something pretty profoundly different to keep up the future viability of the company in terms of its ability to grow.
Well, hold on to that thought, and I'd like to ask you shift a little different question, and it goes more to, as Kevin was saying, the basic blocking and tackling of a board. There's been, obviously, along with these discussions of transformational changes and how a board should address it, there's also been a lot of conversation in the intra-board discourse and in NACD generally about how all this affects the core issues of boards' approaches to composition, refreshment, the ability of the board to make decisions or to delegate to committees. Do you have some thoughts on how all these risks and transformational changes affects the basic way the board is structured?
So I think on one very basic level, I think that what boards exist to do in many ways, in addition to the fiduciary obligations to shareholders in the worlds that I'm familiar with, is to be a resource for management. And so I think that in terms of composition, in some ways, a really important question is what would help management, right? Like, and I've seen board members be incredibly engaged in the company when there's something that they can bring that's really helpful. And I've seen board engagement suffer when there just isn't as much that the board can help the current management team with. And so when I think about, composition and freshness, I think that, you like think about who the management team is at any given time. Where are they in their career arc? What are the things that they need people to help them with? And sometimes that's specific industry expertise. Sometimes it's not. Sometimes it's management expertise. And then, I do think with the risks that we've been talking about, I do think that, a core decision about like, what is the scope of an audit committee? What is the scope of a compliance and risk committee? Should those committees be separate? Who owns jurisdiction over cyber if you have a risk and an audit committee? That I think is very important in light of the cyber issues we've been talking about in healthcare, in light of the technology opportunities that exist that we've been talking about in healthcare. And I again reiterating that point that I think some degree of technology expertise, cyber expertise alongside should be valued the same way and targeted the same way that we think about financial expertise when we think about board composition, I think going forward. Let me pause there and see what other people think.
Well, yeah, and I'm very, with your points, Kevin, you made some comments earlier in our presentation today about basic education, what the board needed to know and understand. We were talking about things such as transformation and AI and cyber. What's your take on the composition issue, the refreshment issue? And I'd also like to raise how do you use committees within your boards?
Yeah, so I'd say, first of all, I come at this with a very specific prism, which is of looking at boards of provider organizations and specifically a nonprofit provider organization. So I'll admit I'm not speaking to the larger issue, although that's a pretty big segment. I think when we look at it from the perspective of nonprofit provider organizations, we're not doing this correctly. So when I look at boards for hospitals, for health systems, they've traditionally been composed, they're very large, they're unwieldy in some ways. They rely heavily on recruiting people for philanthropy purposes. I mean, all those things are important. I don't want to suggest that they're not. As systems get bigger, it is typical to say, let's have them be representative. But representative of what? Not representative of our patient population, but representative of the constituents that are part of the merger. And I don't think that that's the future, right? The future, I think, just like organizations themselves need to be more nimble and more responsive, we need boards that are going to be more nimble and more responsive. And that's not larger, that's probably smaller. So that's in terms of number. That's not representative of each individual constituency that comes to the table in a merger. That's a very different sort of board than a typical board for a nonprofit hospital or a healthcare system. And we've not seen that change yet. but I think we're gonna have to see that change. We're starting to, but I think we need to push ourselves to see more of a change there.
How do you prompt that change within a board that's been longstanding and focused traditionally on historical board issues?
You raise the issue and have that discussion. And I think the vast majority, people are there because they want to do the right thing. Have that discussion about whether or not we are serving the purpose that we're there for, and how we as a board, not just we as an organization, how we as a board could better serve the missions that we're here to serve. I think when you have those open, honest discussions, and then you ask yourselves, is the structure that we have best serving that purpose? I think ultimately you'll get to the right answer.
Well, and I want to ask Phyllis this question as well. How about the more difficult questions of what NACD calls as offboarding? When it's time to move board members off? What do you see your role in management is in addressing that broader issue of evaluations, offboarding, and time to increase the turnover at the board level? For you,
Is that
yeah.
a question for Kevin?
Yeah, I'd like to, Kevin, and then turn to you.
Yeah, I mean, I'm part of that discussion. Ultimately, I think more importantly, I was part of the discussion about how we structured ourselves. So for Beth Israel Lahey, we have the advantage of we're a relatively new organization. We're only 5 years old. We're composed of organizations that have been around for more than 100 years. But the current system is only 5 years old. And we had the advantage when we came together of saying, let's start afresh. Let's put in place a set of bylaws and other things that reflect the way that we think this should work in the future. So we did have to have representative constituents on the board as we came together, but we very specifically said that's for the first term, and that will not exist after the first term. So we've already moved on from that, and it's a self-perpetuating board on now with no guarantee of legacy representation. We did put in place very clear and relatively strict term limits that we're adhering to. But we had the advantage of being a quote unquote new organization. It's really hard to do that when you're talking about an organization that's done things a certain way for 100 years and getting them to change. Take advantage of it when you can. And I think that in my own organization, that's exactly what we did.
Phyllis, I'm going to lean back in my chair and listen to you on this, because with your board experience, I know you've got a lot to offer on these couple of questions.
Well, corporate boards have a slightly different expectations than what Kevin described as the traditional nonprofit board. And there are a lot of best practices that are out there about board refreshment and size. I mean, all my boards are 9 to 11 people. We do a skills matrix to look at our current skills and determine what skills we need in the future and therefore what's missing. So those processes are in good shape. The thorniest issue is the one Michael raised, which is how do you create room for new board members? How do you move people off? And, you know, there are a couple of different ways. On the Blue Cross board, because we're sort of in between a nonprofit and a corporate board, we actually have term limits. So I am in my last year as a Blue Cross Blue Shield of Mass board member because I term out, and isn't that a good thing? Because there's room for new people. On most of my other real corporate boards, we do not have term limits. We've terms of 1 year because that's what good governance now demands. But we don't have term limits, and I think it's useful to have at least a notional sense that 10 years is the right amount, 12 years is right. It's sort of in there. I always thought it would be very hard for a management team, for the Kevins of the world, if we had too short. If we were limited to 8 years or something, that means the average board member is 4 years old. It's hard on a management team. On the other hand, you know, you don't want the 20, you don't want a very tenured board because it's hard to bring on the new people. So it is the tricky thing. I have very little experience with unperforming board members. The board members I work with do their homework, come prepared, are eager to help, are not jerks. They behave well in board meetings. They speak up, but not too much. They're independent for management, but they're not jerks to management. I mean, it said you need the behaviors in addition to the competencies. And I've been lucky. And so how do you move somebody off a board? I think it's helpful to plant in people's minds that there's sort of an expectation. And a couple of years in advance, you're starting to lay the groundwork for moving off a couple of years later. And that's a shared responsibility between the board chair, the CEO, who are sometimes the same people, and the head of nominating governance. And it is the hardest thing, Michael, I agree.
As we run out, before we run out of time and are going to be zeroing in on some of the final questions, Phyllis, as from your perspective, how would you describe the health of the board management dynamic right now, just succinctly, with all this transformation going on? Are relations between the board and management generally better, stronger, more strained? In a nutshell, how would you describe that?
Better / as strong as ever, because the interactions are more frequent, deeper, and more engaging.
Kevin?
I mean, I think we've had better interactions over the last few years because the pressure on the industry has forced us to have open, honest discussions about the right things. And so I've got nothing but good things. I mean, I have a very similar experience to Phyllis in a board that has been nothing but strategic and wanting to be helpful and yet pushing in the right ways. And I feel lucky. And I think, that's partially because of the board that I have, but it's partially because of the times that we're in.
And Jeremy?
Yeah, I mean, I think talking about exogenous forces is quite unifying between boards and management teams, right? Because you're all looking at it together. And it's also some of the areas where, in fact, the management team might have less of a baked answer than some of other sort of matters before a business and a board. And also where board members' particular expertise might be very, very, very relevant. So it's almost the sweet spot of some of the most pleasant and interesting and intellectually stimulating conversations that boards can have versus, say, when you're dealing with a financial restatement or something like that, which is a completely different dynamic when that kind of conversation happens. And so what I've also seen is where board members get to feel like they're helping and they get to feel like they're creating value by bringing sort of the Blink model that they've built throughout their career of what pivot moments mean and how to approach big moments of change, and how to keep it all balanced. And so I think this brings about some of the best conversations, I think.
Well, before we leave this topic, I think one of you, maybe was Kevin, earlier mentioned the concept of the opportunity available to board members under the current environment. Is that accurate? Should board members be looking in the healthcare industry, be looking at board service right now as something to be afraid of or an opportunity? What thumbs up or thumbs down on that? Phyllis, what do you think?
It's a fabulous opportunity of impact, but you've got to be willing to invest the time. It's a greater demand, but more important.
Kevin?
Yeah, I agree with that. I think, again, no different than for people that on the management side going into healthcare. And I talk about this with people all the time. It's unprecedented times. There are huge challenges in front of us. And yet, if you truly care about affecting significant change across a broad swath in healthcare, now's the time. There hasn't been this much change in healthcare at least since the 1960s and the introduction of Medicare, and maybe even before that. And if what you truly care about as a potential board member is affecting significant change, lean in. I mean, I can't imagine a more exciting time to do that with all of the risks and challenges that face us.
And Jeremy?
100% agree with that. I would also just say though that you have to have a stomach for a very difficult landscape, right? So you, on the one hand, you've got CMS under HHS, you've got CMS who thinks one thing, and then you've got the OIG that thinks another thing, and then you've got the Department of Justice sitting out on another executive office that doesn't really care what the OIG or CMS thinks. And by the way, you can't ask anybody whether what you're doing is compliant or not. They won't answer the question. And they certainly, if you choose to ask a question, they might never give you an answer, right? And so, and it can take like years and years. And so you've got to be, and then there's the, we haven't talked about like the key TAM risks in healthcare, which are just sort of all over the place. And so, whether it's a cyber event, it's a whistleblower lawsuit, it's some fundamental disagreement between the DOJ, the OIG, and CMS, you're gonna, that's stressful stuff. And you gotta just have stomach for it. And you've got to, and also do a lot of due diligence about making sure that the compliance framework of a company you're involved with is as ethical and as strong as you need it to be, because you're, when these headlines come out, they're really bad. And you've got to make sure that you believe that the company's been doing the right thing and will do the right thing, and help them prepare for the sort of more when, not if kind of thing, right? Which is that depending on the segment of healthcare that you're in, these are real issues you're going to have to confront as board and management. So
We've got
tons of opportunity, but also you got to have the stomach for it.
I guess that means we don't want to talk about the DOJ's new whistleblower program on this presentation. We'll save that. We'll put that for another presentation. Phyllis, can you kick off the last couple of seconds of our presentation this morning with, I guess your two messages to the folks who have been listening in this morning. What are your key takeaways if you're listening to the conversation that the three of you have led just really brilliantly? What are the key points that you would encourage board members to take away?
I would have two pieces of advice. One is to ask management for briefings on different topics so that you are more knowledgeable and more expert. And these are outside of board meetings, but a deep dive into key topics that the executive team, the C-suite, is in a position to talk you through, even one level down. They'll love it. But I think just we need to know more, and we don't need to read stuff. I think the management team's in a position to really educate us, and just ask for that. And I've done this now in several companies, and the topics vary obviously, but it's very worthwhile. The second piece of advice is to have a balanced view of AI and encourage, Jeremy used the word to ask the management team, what's the size of the prize? How much could this be worth? How important is it? And encourage them to walk down that path and to set the right frameworks for control and governance and so on. But it's not all about risk. You've got to lean into it, or competitively, you will be left behind.
Kevin, you're up. Your two key points.
Yeah, I think both of my points have to do with focus. And the first is, at least in my space, let's not lose sight of why we're here. And what a really good board can do in the nonprofit provider space is to make sure that we maintain our focus on mission or on multiple missions. And it's easy to get lost in the myriad of challenges or opportunities or latest merger and all of those things are really important. But let's go back to sort of first principles. Why are we here and what are we trying to do? And a good board can help with that more than anything else. So focus on what is your mission. And the truth is, that's not just in a nonprofit, that's in any organization. Help the organization focus on why it's here, and are the decisions and challenges in front of it the right ones to serve the missions that we're here to serve. And, secondary to that is to help an organization and teams focus more specifically on the small number of things that are most important. Boards and management teams tend to get lost in the noise sometimes. And the most important thing that you can do is figure out what's important and what's not, and then focus ruthlessly on those things that are important. A good board does that and helps its management team do that.
Jeremy?
It's hard to go last on this one because you have to have two unique ones. So one I would say is do a health check on cyber readiness. I think that the recent events of the world kind of make it even more a fiduciary obligation of boards right now to understand the organization's posture and to understand key vendor dependencies, and also to understand what a realistic business continuity plan might look like, particularly under the bad attacks we've been seeing. These are ransomware attacks. These are the ones that go on for weeks and weeks and weeks. And do we have contracts ready to pull in experts, which is something you're going to need to do. So I would do that. And then, the other thing I would say is that I think there's a temptation to focus too much on the exogenous, when at the end of the day, like the vast majority of the time, the problems that a company faces or an organization faces is of their own doing and is not imposed from the outside. Right. So the outside headwinds are most often generally faced by everybody in an industry, not one organization uniquely. And so I think I've been in meetings where there's been too much focus on all the goings on in the world that are exciting and challenging and present opportunities and a lot of risks, and almost and it's a way to skirt around. Well, how are we just performing, right? Because it's sexy, it's interesting, I took this lesson to heart when I worked at Wayfair, which was my diversion out of my sabbatical outside of healthcare, which is, every day we came to work thinking that Amazon was trying to kill us, and every single day that I came to work and something broke or wasn't going as well as we thought it would go, it was always something we did to ourselves. Always, 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 always. It was not Amazon trying to kill us. And I think not forgetting that lesson is important.
Before we walk away, I have to ask each one of you one simple question, because it's something, as listening to you the last hour was popping up on my mind. Should a board member think that healthcare and its challenges and its transformation is totally and completely unique? Or is a board member better advised to look at healthcare as just one of many types of industries that are going through this transformational structure? Are we that different, Phyllis?
There are absolutely unique aspects to healthcare, and we've talked about a number of them. Jeremy talked about the compliance risks, and boy, I've been deep on that issue. Whistleblowers, lawsuits, having a legal report in the boardroom. There's some unusual aspects from our regulatory framework. Kevin has spoken to dealing with mission and real patients here, and so the life or death elements of what is delivered here is unique. They're clearly unique things. Having said that, I've always been impressed. My boards always have had a third to a half of non-healthcare people on them. And it's really impressive how much value they add. It is an arcane business in a lot of ways. They come up to speed quickly, and they do add a lot of value. Financial services, there's so much value they bring because they have regulators technology is even more important to their business than to ours. There's so many things that are important. So I like having boards that are composed of deep healthcare people and non-healthcare people. I think the combination's quite magical. And from a personal standpoint, I'm now on two life science company boards. I'm not a scientist. This isn't my thing. And so I am forced for the first time to finally add value in the way those financial services people add value to a healthcare services board. I have to actually elevate and think about ways to add value to a life sciences company. And again, I think it is the magic of putting those two sides together.
Jeremy and Kevin, we're about out of time, but I see you guys shaking your heads. Looks like you're in agreement with Phyllis's perspective that we may be different, but we're not all that different, that we can't bring in people from the outside to help us evaluate. Well, let me thank you. This has been an absolutely fascinating conversation. My wrist is sore from taking notes and trying to moderate at the same time. We'll see if I can figure out what my notes actually say. I want to turn it back now to Ellen Zane and NACD, but I'd like, before I do so, thank each one of you for just a delightful way to start. It's Wednesday, isn't it? Wednesday morning.
Right.
Ellen?
Thank you, Michael. And truly, it was an extraordinary session. And thank you so much, Jeremy, Phyllis, and Kevin, as well as you, Michael. It was I've been getting some emails myself about people who feel that this was a very valuable session. So thank you. A couple of quick announcements before we set you on your way. Our program calendar is scheduled through June, and we hope that you'll join us for one or more of our upcoming events. First, I want to take note of the full day programs. We offer two. On April 11th, we will hold an Aspiring Public Company Director program, which is designed for individuals who currently sit on large not-for-profit boards or private corporate boards, and or are C-suite leaders who wish to take the next step towards securing a public company board seat. Public company directors and industry experts will lead the discussions, and we're really quite confident it will be of great value to you all. The second day-long program is June 13th and will cover advanced topics for experienced public company directors. On April 3rd, we have an in-person breakfast event. We are co-hosting with the Massachusetts Business Roundtable. It's entitled Translating Sustainability into Strengthening a Company and Its Future. I also want to add, on the 24th of April is the NACD Director of the Year dinner. It is our key event of the year. And for anyone who is interested in corporate directorships, it is the place to be for the year. It will be at the Seaport Hotel again on April 24th. And let me announce that one of our august speakers this morning, Jeremy's company, Devoted Health, is going to be receiving the Private Company of the Year award. And congratulations, Jeremy, to you and your colleagues at Devoted. Finally, don't forget the survey. The link is in the chat, and it will be in a follow-up email. And please take a moment to fill it out. So thank you for everybody for attending. Have a wonderful day. And once again, thanks to our panel. Bye now.